Many women believe they're tracking ovulation correctly, yet month after month, nothing happens. That's because ovulation tracking is often misunderstood. Counting days, relying on apps alone, or assuming ovulation always happens on day 14 can quietly reduce your chances of conceiving. In week 2 of the TTC Roadmap, we'll break down how ovulation really works, the most reliable ways to track it, common mistakes to avoid, and how to combine methods for the most accurate results. Understanding ovulation. Ovulation is the release of a mature egg from one ovary. Once released, the egg survives for 12 to 24 hours. If sperm is not present during this short window, pregnancy cannot occur. Sperm, however, can live up to 5 days inside the female reproductive tract. This is why ovulation tracking isn't about one single day. It's about identifying a fertile window, which we'll cover in detail in week 3. Common ovulation tracking myths. Let's clear up some common myths. Ovulation does not always happen on day 14. A regular period does not guarantee regular ovulation. Fertility apps do not know your hormones. One positive OPK does not guarantee ovulation occurred. Understanding these myths helps you avoid relying on inaccurate assumptions. Basal body temperature tracking. Basal body temperature tracking helps confirm ovulation after it happens. After ovulation, progesterone causes your resting temperature to rise slightly. How to track BBT correctly. Take your temperature immediately upon waking, before sitting up or speaking, at the same time every morning after at least 3 to 4 hours of sleep. Use a basal thermometer with 2 decimal places. BBT is best used to identify patterns over several cycles rather than as a real-time predictor. Ovulation Predictor Kits. OPKs detect the surge of luteinizing hormone, or LH. The LH surge usually occurs 24 to 36 hours before ovulation, making OPKs useful for predicting fertile days. OPK tips. Begin testing a few days before expected ovulation. Test at the same time daily. Avoid drinking large amounts of fluids before testing. Track both rising and peak results. OPKs predict ovulation, but they don't confirm that ovulation actually occurred. Fertility apps, what they do and don't do. Fertility apps use algorithms based on previous cycle data. They can be helpful for logging symptoms, storing temperature and OPK data, and identifying cycle patterns over time. However, apps are only as accurate as the information you enter. They should support your tracking, not replace it. Combining methods for best results. The most reliable approach is combining methods. OPKs help predict ovulation, BBT confirms ovulation, apps organize your data. Together, they provide a clearer picture and reduce guesswork. This method is especially helpful for women with irregular cycles. Who may need extra monitoring? Ovulation tracking may be more challenging if you have irregular cycles, have PCOS, recently stopped hormonal birth control, experience high stress, or disrupted sleep. In these cases, consistency and multi-method tracking become even more important. Ovulation tracking doesn't need to be overwhelming. When you understand your body and use the right tools together, timing becomes clearer and less stressful. In week 3, we'll focus on finding your exact fertile window so you know precisely when pregnancy is most likely. Subscribe and follow the TTC Roadmap step by step. Thanks for watching.